And so we have once again Mr. Mejia. El señor Mejia comes over from the county of Sonoma to update us as to what's going on with COVID, what's going on with the schools, what's going on with the vaccine, so on and so forth. Welcome once again, and can you give us some information as to what is the latest on COVID numbers as well as the vaccination?
I'll be happy to do that, Rafael. Let's start with the cases. The cases continue to decline, although we continue to have a generalized level of spread of the virus. For this week, with metrics that are measured by observing 7 continuous days per every 100,000 inhabitants, we find that 9.9 general cases are there in general. And when we look at this figure through vaccination status, it coincides with 9.9 for the unvaccinated and 1.9 for those that are vaccinated. So you see the big difference between vaccinated and not vaccinated persons. Talking about vaccinations, we continue making progress in vaccinations. A slow but steady pace at 1% per week for the eligible population. That has led to have now 76.5% of residents that are eligible fully vaccinated and 7.9% that are partially vaccinated. When we put these two groups together, that means that so it's 84.4%, we're almost close to 85%. The eligible population is fully or partially vaccinated. For now, Sonoma County's priority continues to be getting more first doses and getting more people fully vaccinated. 16% of the eligible county residents have not received a dose to date, and children under the age of 12 are currently not eligible to get vaccinated. That means that almost 30% of the residents in the county are not vaccinated. We continue to advance vaccination, as I said, but we need more people joining us with vaccinations. The younger and unvaccinated residents continue to be the hit hardest with high numbers of hospitalizations and death. As of Monday, 40 COVID patients were in Sonoma County hospitals. This included 16 COVID patients in ICU beds. And the county has reported other 2 more deaths this week to make a total of 17 persons who died during September. And let's remember that 34 persons died in August and 16 died during July. Almost all of the 386 deaths that have occurred precisely in unvaccinated residents. Over the past 60 days, 45% of new local cases have occurred in people between ages 18 and 44. Another 17% occurred in children whose age are 5 to 17 years old. Primarily because many of them are still ineligible to be vaccinated and are back at school. Now I'd like to talk about the boosters. That is a topic that everyone is talking about these days. The FDA Food and Drug Administration authorized booster shots last week for some people who received their second dose of Pfizer. This is all related to the Pfizer vaccine only. Moderna and Johnson & Johnson are still not approved by the FDA. This pertains only to Pfizer's. So Pfizer had already, well, the group that has been approved before is the 65 and older. That's the group that has been traditionally more affected during the pandemic. And also 65 and older are the groups that are more vaccinated. So there's another group that has opened from 50 to 64 years old with certain underlying conditions, and also people who live in long-term care facilities such as nursing homes. Also, there's another group for people with underlying conditions that starts at age 18 to 49, and then also 18 to 64 for those essential workers that are, for example, healthcare workers or first responders or teachers or postal service workers and agricultural and food workers. all of them are eligible. So if you who are listening now got a Pfizer shot, you can get your third round of vaccinations now. To obtain your vaccine, the county recommends that eligible residents use myturn.ca.gov to make an appointment. For those covered through one of our major medical providers, such as Kaiser, Sutter, or Providence, the county encourages you to contact your primary care physician to determine if you are eligible for a booster and to schedule an appointment. The underlying conditions that qualify for a booster shot are hypertension and heart disease, diabetes or obesity, cancer or blood disorders, weakened smooth immune system, chronic lung, kidney or liver disease, dementia and certain disabilities, pregnancy, and for those who are smokers currently or formerly, all of them are eligible for these Pfizer shots. And Pfizer also has declared that its vaccine for the children aged 5 to 11 is safe, and the FDA is now in process to approve that. It's expected to be approved by the end of this month or early in November. In the meantime, the county is in discussions with the Sonoma County Office of Education about creating vaccination clinics in schools and also in creating this campaign to educate parents. Parents need to give their consent, and they're absolutely right about being concerned of the safety of the vaccine. So we are inviting them to get in touch with their school. There's going to be different dates, variations about when and how these talks are going to happen. So contact directly the school for more information. It is expected that all this group of kids aged 5 to 11 are we're going to be campaigning intensely to get them vaccinated. The goal is to vaccinate 70% of them before the end of this year. That's the goal. Hopefully we can get to that. Because when we look at the schools, I was already mentioning that kids are being affected. We have 451 cases of COVID-19 since the schools reopened. And of these cases, 408 are students and 43 are staff members. The majority of these cases are happening in primary schools and in high schools. On the other side, we're seeing a growing trend in mandatory vaccinations. The city of Santa Rosa, starting tomorrow, are going to require their 1,500 employees to get vaccinated or get tested. But on the other hand, Sonoma State is requiring, so today is the deadline for their students to send proof of vaccination. As of Monday, 82% of the students have complied with this requirement. And for them, there is no trial option available. The only exception is for medical and religious beliefs. And the exception for students and staff who plan to be 100% remote or not enter the campus, but that creates a very different situation. Another one is for immigrants to the United States. People who want to enter the country as an immigrant has to be vaccinated, and there is no option for test. Finally, I have to tell you that the eviction moratorium also expires today, and starting tomorrow for those who are in need of financial assistance because they are late with the rent or utilities. If you haven't applied now with this expiration of the moratorium, your last resource is to apply for ERA before your tenant gets the rights, and they have it now if they don't live in the state, but they have properties in the States, to start a process for eviction. They still have to help you apply if you are a tenant. The landlord needs to apply for assistance for their tenants. But if it's not approved because the tenant is doing too much money or has procrastinated this last chance, they could be facing eviction as early as November 1st. So please get in touch with Legal Aid. They can help you with low cost or no cost. If you give them a call at 707-843-4432 or visit their website, which is Legal Aid. sc.org to find more information. And another benefit that is ending today also is the SB95, or the supplemental assistance for sick leave. We don't know if it's going to continue. We know that it expired in 2020 as well, and it took a few months to come back. At this point, we don't know if it's going to open. And that's unfortunate because we are still having a lot of cases, but that's the circumstances with finances. They come and go, they're not eternal. So when we talked about it, I hope that the people that listen really pays attention and take advantage of these benefits, because as we know, for a second year, they are ending, Rafael.
Yeah. And again, it's really, really important that people pay attention. It's really important that people understand there's limitations to all of this. And I would hate for community members who are not taking care of themselves and their needs, that they may end up homeless starting in a month as a result that they, again, haven't taken the steps necessary. You've been coming here for several weeks now and spoken about these benefits, the 30-something, I think it was $34 million available to support people with rents and utilities. And yet the money is still there, not all the 34, but I would have guessed that a lot of people would have applied. And just a reminder to our community that if you're undocumented, you can still apply for those benefits. But again, those are the things. We can only do so much. And to a certain degree, live with the consequences of the situation. So in general, I just want to thank you for taking the time. And, earlier in Spanish, I didn't say it, but you mentioned about vaccination and how it was done at the schools. We did participate with our volunteers over at Roseland, in the Roseland area, but it was at LC Allen High School. And we already reached out to find out how we can support with the 5 to 11. It's been 2 weeks, haven't gotten a response. So we hope that somebody over there at the county or at SCO, the collaboration that they have, that somebody will get back to us, because, people want to support. People are seeing this as an essential thing. Children shouldn't have to get sick when there is a vaccine. So looking forward to hearing more about those numbers as soon as the vaccination starts. And to our brothers, sisters, non-gender conforming individuals who are working in the fields, making the uber wealthy more wealthy here in Sonoma County, again, just a reminder, you are eligible for the 3rd shot of the Pfizer vaccine. If that's what you had, again, go and make your appointment in order to be able to get that vaccine. You need to protect yourself, you need to protect your children, you need to protect your family and friends. And with that, I want to thank you again, Senor Marcos Mejia, for taking the time and being with us here at Líderes del Futuro on KBBF 89.1 FM and on the web at kbbf.org. And I look forward to our next conversation.
Thank you for having me. I'll be giving you more updates. I think the topic with the school is going to be the hot topic in the next weeks. And I hope that we make a lot of progress and that we have more clarity about these education classes for the parents, because we know that there are studies there that says that 3/4 of the people who got a shot wants to get vaccinated again. And most parents want to get their kids vaccinated too. So we will be talking more. Thank you, Rafael, and I'll see you next Thursday.
Definitely. Thank you. Take care.
Thank you.